appropriate and should be expected. In fact, it is expected you will feel emotional about the death of a patient. Feelings and emotions are part of the grieving process. All of us experience these feelings after a stressful situation that causes us personal pain. In 1969, Dr. Elizabeth Kubler-Ross published On Death and Dying, which revealed her theory on the stages of grief people go through. They are as follows. 1. Denial. Refusing to accept diagnosis or care, unrealistic demands for miracles, or persistent failure to understand why there is no improvement. 2. Anger, hostility. Projecting bad news onto the environment, and commonly in all directions, at times almost at random. The person lashes out. Someone must be blamed, and those who are responsible must be punished. This is usually an ugly phase, and it may even be inappropriately directed toward the emergency medical technician. 3. Bargaining. Attempting to negotiate a favorable outcome for good behavior or promising to change. I promise to be a perfect patient if only I can live until X event. 4. Depression. Internalizing anger, hopelessness, and the desire to die. It rarely involves suicidal threats, complete withdrawal, or giving up long before the illness seems terminal. The patient is usually silent. 5. Acceptance. Accepting the impending death of the patient, or accepting the death of a loved one. The stages may follow one another, they may occur simultaneously, or a person may jump back and forth between stages. The stages may last different amounts of time. Even though the event, death, has not yet happened, the patient knows that it will happen. The patient has no control over this process. The patient will die whether or not he or she is ready to die. As an emergency medical technician, you may encounter situations in which the patient is close to death, and you may need to provide reassurance and emotional care. What can the emergency medical technician do? As patients and bystanders are grieving, you can do helpful things, and make simple suggestions. Ask whether there is anything that you can do that will be of help, such as calling a relative or religious advisor. Provide gentle and caring support. Reinforcing the reality of the situation is important. This can be accomplished by merely saying to a grieving person, "I am so sorry for your loss." It is not important that you have a well-rehearsed script, for it is not likely that your exact words or consolations will be remembered. Being honest and sincere are important. Some statements of consolation tend to be trite. Although these statements may be said with the intention of making the person feel better about a situation, they can also be viewed as an attempt to diminish the person's grief. The grieving person needs to be validated. Statements like these can indicate our inability to comprehend the profound sadness of grief because you have not experienced that kind of loss. If you have not experienced a death, it is okay to say so, do not pretend you have. Attempts to take grief away too quickly are not good. If you do not know how the person really feels, you should not say so. People may be offended by responses that give advice or explanations about the death. Statements such as, "Oh, you shouldn't feel that way," are judgmental. If you judge what the grieving person is feeling, it is likely that he or she will stop talking with you. People feel what people feel. Remember, anger is a stage of grieving. The anger may be directed at you. The anger seems irrational to everyone except the person grieving, therefore, it is necessary that you maintain a professional attitude, and let the person grieve in his or her own way. Statements and comments that suggest action on your part are generally helpful. These statements imply a sense of understanding, they focus on the grieving person's feelings. It is not necessary to go into an extensive discussion. All you need to do is be sincere and say, "I am so sorry for your loss. I just want you to know that I am thinking about you." What people really appreciate is somebody who will listen to them. Simply ask, "Would you like to talk about how or what you are now feeling?" Then accept the response. Assisting patient and family members. There is no right or wrong way to grieve. Each person will experience grief, and respond to it, in his or her own way. Family members may express rage, anger, and despair. Many people will be rational and cooperative. Their concerns will usually be relieved by your calm, efficient manner. Your actions and words, even a simple touch, can communicate caring. Although you must treat all patients with respect and dignity, use special care with dying patients and their families. Be concerned about their privacy and their wishes, and let them know you take their concerns seriously. However, it is best to be honest with patients and their families. Do not give them false hope. Stress management on the job. Emergency medical service is a high-stress job. Understanding the causes of stress and knowing how to deal with stress are critical to your job performance, health, and interpersonal relationships. To prevent stress from negatively affecting your life, you need to understand what stress is, its physiologic effects, what you can do to minimize these effects, and how to deal with stress on an emotional level. Stress is the effect of stressors on your physical and mental well-being. Stressors include emotional, physical, and environmental situations or conditions that may cause a variety of physiologic, physical, and psychological responses. The body's response to stress begins with an alarm response, followed by a stage of reaction and resistance. These stages are followed by recovery, or, if the stress is prolonged, exhaustion. This three-stage response is referred to as the general adaptation syndrome. The physiologic responses involve the interaction of the endocrine and nervous systems, resulting in chemical and physical responses. This is commonly known as the fight or flight response. Positive stress, such as exercise, as well as negative forms of stress, such as shift work, long hours, or the frustration of losing a patient, all have the same physiologic manifestations. These responses include the following: increased respirations and heart rate, increased blood pressure, constricted venous vessels near the skin surface, causes cool, clammy skin, dilated pupils, tensed muscles, increased blood glucose levels, perspiration, decreased blood flow to the gastrointestinal tract. Situations that are stressful for emergency medical service providers include the following: dangerous situations, physical and psychological demands, critically ill or injured patients, dead and dying patients, overpowering sights, smells, and sounds, multiple patient situations, angry or upset patients, family, or bystanders, unpredictability and demands of emergency medical service, non-critical or non-emergency patients. As you examine this list, you will see some situations are clearly stressful, a car crash where a child is killed or a terrorist attack. Other situations may seem confusing. You may ask yourself why caring for non-critically ill patients would be considered stressful. You will need to manage several patients, and one person's definition of an emergency may be quite different from that of another. As you begin your career in emergency medical service, you may envision that all of your calls will be exciting life and death calls where you are able to save lives. In reality, most patients are not critically ill and the care they need can become rather routine. This can create stress in people who are unable to make the transition from the TV image of emergency medicine to its reality. Reactions to stress can be categorized as acute, delayed, or cumulative. Acute stress reactions occur during a stressful situation. You feel nervous and excited, and your ability to focus increases. This focus can be very helpful in managing a crisis situation. But if the stress of the situation becomes too great, you are at risk of being caught up in the emotional and physical reactions to stress. Picture stress as a wave in the ocean. If the crest of the wave is too high, you can potentially become overwhelmed and drown. If stress goes unrecognized and is not relieved, you can be overcome by it. Delayed stress reactions manifest after the stressful event. During the crisis, you are able to focus and function, but after things have calmed down, you may be left with nervous, excited energy that continues to build and becomes a distraction. With both acute and delayed reactions, the important question to ask yourself is: how did you manage these feelings during the stressful event? Were you able to continue, managing the stress well and taking it in stride? Or, were you unable to manage the stress well, resulting in a delayed stress reaction? Cumulative stress reactions are the most important to understand. After the stressful event is over, are you able to shake off the effects? Are you still tired? Cumulative stress occurs when you are exposed to prolonged or excessive stress. You fight to remain in control, and you are successful, but you are starting to grow tired. Now the next stressful situation occurs. Each time, you find it harder to recover because the effects of the previous stress are tiring. Cumulative stress can cause physical symptoms such as fatigue, changes in appetite, gastrointestinal problems, or headaches. It may cause insomnia or hypersomnia, irritability, inability to concentrate, and hyperactivity or underactivity. Additionally, it may present with psychological reactions such as fear, dull or non-responsive behavior, depression, guilt, oversensitivity, anger, irritability, and frustration. A fast-paced lifestyle compounds these effects by not allowing a person to rest and recover after periods of stress. Prolonged or excessive stress has been proven to be a strong contributor to heart disease, hypertension, cancer, alcoholism, and depression. Many people are subject to cumulative stress, whereby insignificant stressors accumulate to create a larger stress-related problem. In the emergency services environment, emergency medical service personnel, law enforcement officers, firefighters, stressors may also be sudden and severe. Some events are unusually stressful or emotional, even by emergency medical service standards. These acute severe stressors result in what is referred to as critical incident stress. Events that can trigger critical incident stress include the following: mass casualty incidents, serious injury or traumatic death of a child, crashes with injuries caused by an emergency services provider while traveling to or from a call, death or serious injury of a coworker in the line of duty. Post-traumatic stress disorder. Post-traumatic stress disorder may develop after a person has experienced a psychologically distressing event. It is characterized by re-experiencing the event, and over-responding to stimuli that recall the event. Stressful events in emergency medical service are sometimes psychologically overwhelming. Some of the symptoms include depression, startle reactions, flashback phenomena, and dissociative episodes, for example, amnesia of the event. A process called critical incident stress management was developed to address acute stress situations, and potentially decrease the likelihood that post-traumatic stress disorder will develop after such an incident. The process theoretically is used to confront the responses to critical incidents, and defuse them, directing the emergency services personnel toward physical and emotional equilibrium. Critical incident stress management can occur formally, as a debriefing for those who were on scene. In such situations, trained critical incident stress management teams of peers and mental health professionals may facilitate this. Additionally, critical incident stress management can occur at an ongoing scene in the following circumstances: when personnel are assessed for signs and symptoms of distress while resting, before re-entering the scene, during a scene demobilization in which personnel are educated about the signs of critical incident stress, and given a buffer period to collect themselves before leaving. Defusing sessions are the first to occur. These sessions are held during the event or immediately afterward. A group informally discusses events that they experienced together. Defusing sessions are designed to educate the participants as to the expectations over the next few days, and give guidance on proper techniques to manage the feelings they may be experiencing. One example is to discourage drinking alcohol during this stressful time. Debriefing sessions are held within 24 to 72 hours of a major incident. These meetings are held by a critical incident stress management team consisting of peers and mental health professionals. At the debriefing session, pent-up emotions can be properly expressed. It is more likely you will be ready to express your emotions more freely a few days following the event. One of the important rules associated with the debriefing session is to not turn it into an operational critique. No one is right. No one is wrong. No one is to blame. Only emotions about the specific event are to be relayed. These debriefing sessions may have to be repeated at a later time. Critical incident stress management programs are located throughout the United States. You can locate a critical incident stress management in your area via the internet, or it can be requested through your employer. The International Critical Incident Stress Foundation is dedicated to limiting the effects of stress on emergency medical service providers through education and support services. For more information, go to the Foundation's website at www.icisf.org. Critical incident stress management is a helpful service for many providers, but it is not effective for everyone. Some providers are not receptive to help by openly discussing psychologically traumatic memories with peers. If an emergency medical technician does not wish to participate in the critical incident stress management program, other services such as employee assistance program or departmental peer support should be offered. When the individual's behavior is noticeably different after the event and critical incident stress management is not an option, private counseling by a mental health professional may be valuable. Burnout. Burnout is a term first coined in the 1970s to describe a combination of exhaustion, cynicism, and reduced performance resulting from long-term job stresses in healthcare and other high-stressed professions. Like other negative aspects of distress, burnout affects not only the personal well-being of the emergency medical technician, but also the well-being of his or her colleagues and patients, through increased errors and decreased performance. In addition to the sources of stress mentioned, too much time at work or volunteering, and excessive non-patient care administrative tasks have been specifically identified as contributors to burnout. Burnout can result in increased major medical errors, increased likelihood of being involved in a lawsuit, increased rates of healthcare-associated infection, and increased patient mortality. In addition, burnout contributes to decreases in work morale, overall work effort, effective teamwork, and patient satisfaction, and an increase in job turnover. Compassion fatigue. Sometimes described as the cost of caring, compassion fatigue is common among those who work in healthcare and disaster and emergency services. Compassion fatigue, also known as secondary stress disorder, is a disorder characterized by gradual lessening of compassion over time. It differs from post-traumatic stress disorder in that post-traumatic stress disorder is caused by direct exposure to a traumatic incident or series of traumatic incidents, whereas compassion fatigue is a reaction to caring for others who have experienced trauma. Symptoms of compassion fatigue include the following: high absenteeism, difficult relationships with colleagues and coworkers, inability to work in teams, aggressive behavior toward patients, strong negative attitudes toward work, lack of empathy for patients, judgmental attitude toward patients, preoccupation with non-work issues while on duty. Other symptoms of increased stress. Supporting patients in emergency situations is difficult. It is stressful for them and for you. You are vulnerable to all the stresses that go with your profession. It is critical that you recognize the signs of cumulative stress so it does not interfere with your work or life away from work, including your family life. The signs and symptoms of cumulative stress may not be obvious at first. Rather, they may be subtle, and they may not be present all of the time. Responder risk for suicide. Whereas suicide is the 10th leading cause of death in the United States, the rate among emergency responders is much higher. Firefighters and law enforcement personnel are more likely to die by suicide than from death in the line of duty. Although statistics like these are shocking, it must be kept in mind that suicides are estimated to be highly underreported, meaning that actual rates of suicide among responders are likely even higher. Job stress is widely considered to be the largest contributing factor to suicide. In addition, the stigma of mental illness can keep responders from taking action to help others or to seek help themselves. In professions where being tough, brave, and reliable under any circumstances are key virtues, it can be extremely challenging for responders to seek help to cope with stress and trauma. It is crucial for emergency medical technicians to recognize the signs of stress and trauma not only in friends and colleagues, but also in themselves. Moreover, it is crucial to seek consultation and assistance. Many emergency response organizations offer their own access to stress management and mental health services along with peer support teams and employee assistance programs. In addition, numerous national services are available to first responders. The Code Green campaign is a mental health and advocacy organization for first responders. Its website directs those in need of emotional support to many resources, including the following: Fire or Emergency Medical Service Helpline, Share the Load, www.crewcarelife.com/crisis-support/1-8-8-8-7-3-1-3-4-7-3. National Suicide Prevention Lifeline, https://suicidepreventionlifeline.org, 1-8-0-0-2-7-3, 8-2-5-5. Center for Firefighter Behavioral Health, www.cffbh.org. Safe Call Now, www.safecallnow.org. Emotional aspects of emergency care. At times, even the most experienced healthcare provider has difficulty overcoming personal reactions and proceeding without hesitation. You may have patients who need to be removed from life-threatening situations, or you need to provide life support measures to patients who are severely injured. You may also be called on to recover human remains from highway accidents, aircraft disasters, or explosions. In all of these situations, you must be calm and act responsibly as a member of the emergency medical service team. You must also realize that even though your personal emotions must be kept under control, these are normal feelings. You must deal with these feelings. The struggle to remain calm in the face of horrible circumstances contributes to the emotional stress of the job. Stressful situations. Many situations, such as mass casualty scenes, serious vehicle crashes, excavation cave-ins, house fires, infant and child trauma, amputations, abuse of an infant, child, spouse, or older person, or the death of a coworker or other public safety personnel will be stressful for everyone involved. During these situations, you must exercise extreme professional care in both your words and your actions at the scene. Words that do not seem important, or that are said jokingly, may hurt someone. Conversations at the scene must be professional. You should not say, "Everything will be all right," or "There is nothing to worry about." A person who is trapped in a wrecked car, hurting from head to foot, and worried about a loved one, knows that all is not well. What will reassure the patient is your calm and caring approach to the emergency situation. Whether you are a brand new emergency medical technician or a seasoned veteran, patients expect you to bring some sense of order and stability to the terrifying chaos that has suddenly engulfed them. Briefly explain your plan of action to assist the patient in the crisis. Inform the patient that you need his or her help, and the assistance of family members or bystanders to carry out your plan of action. How a patient reacts to injury or illness may be influenced by certain personality traits. Some patients may become highly emotional over what may seem to be a minor problem. Others may show little or no emotion, even after serious injury or illness. Many other factors influence how a patient reacts to the stress of an emergency medical service incident. Among these factors are the following: socioeconomic background, fear of medical personnel, alcohol or substance use disorders, history of chronic disease, mental disorders, reaction to medication, age, nutritional status, feelings of guilt, past experience with illness or injury. You are not expected to always know why a patient is having an unusual emotional response. However, you can quickly and calmly assess the actions of the patient, family members, and bystanders. This assessment will help you to gain the confidence and cooperation of everyone at the scene. In addition, you should use a professional tone and show courtesy, along with sincere concern and efficient action. These simple considerations will go far to relieve worry, fear, and insecurity on the part of everyone involved. Your calm reassurance will inspire confidence and cooperation. Compassion is also important, but you must be careful. Your professional judgment takes priority over compassion. For example, suppose a screaming child with no obvious life-threatening injuries is covered with another patient's blood. This frightened child appeals to your sense of compassion, and thus gets your attention. In the meantime, an unconscious, non-breathing adult nearby could die from lack of care. Patients must be given the opportunity to express their fears and concerns. You can easily relieve many of these concerns at the scene. Usually, patients are concerned about the safety or well-being of others who are involved in the accident, and about the damage or loss of personal property. Your responses must be discreet and diplomatic, giving reassurance when appropriate. If a loved one has been killed or critically injured, you should wait, if possible, until clergy or the emergency department staff can give the patient the news. They can provide the necessary psychological support the patient needs after receiving this type of news. Some patients, especially children and older adults, may be terrified or feel rejected when separated from family members by uniformed emergency medical service providers. Other patients may not want family members to share their stress, see their injury, or witness their pain. It is usually best if parents are transported with their children and relatives accompany older patients. Medical attention for a child often requires adult consent. Treatment may be delayed if a caregiver is not transported with the child. Religious customs or needs of the patient must also be respected. Some people will cling to religious medals or charms, especially if you make any attempt to remove them. Other people will express a strong desire for religious counsel, baptism, or last rites if death is imminent. You must try to accommodate these requests. Some people have religious convictions that strongly oppose the use of medications, blood, and blood products. If you obtain such information about your patient, it is imperative that you report it to the next level of care. In the event of a death, you must handle the body with respect and dignity. It must be exposed as little as possible. Learn your local regulations and protocols about moving the body or changing its position, especially if you are at a possible crime scene. Even in these situations, cardiopulmonary resuscitation and appropriate treatment must be given unless there are obvious signs of death. Workplace issues. As our society grows more culturally diverse, so do emergency medical service workplaces. You are required to provide an equal standard of care to all patients, and also need to be able to work efficiently and effectively with other healthcare professionals from a variety of different backgrounds. Cultural diversity on the job. For many years, emergency medical service and public safety have been dominated by Caucasian men. Currently 75% of emergency medical service personnel are male and 85% identify as non-minority. The proactive emergency medical technician understands the benefits of a culturally diverse workforce to eliminate disparities in patient care. Socially equitable care is one of the Emergency Medical Service Agenda 2050 principles. Emergency medical technicians should expect to work alongside coworkers with varying backgrounds, attitudes, beliefs, and values and to accept their differences. Cultural diversity in emergency medical service allows you to enjoy the benefits of accentuating the skills of a broad range of people. When you accept each coworker as an individual, the need to fit them into rigid roles is eliminated. To be more sensitive to cultural diversity issues, you must first be aware of your own cultural background. Ask yourself, what are my own issues relative to race, color, religion, and ethnicity? Because culture is not restricted to different nationalities, you should also consider age, disability, sex, sexual orientation, marital status, work experience, and education. In sports, you play to your team's strengths. For example, in football, offensive lines have a fast side and a strong side, and one plays toward either side depending on the situation. As part of an effective emergency medical service team, you can make it part of your team's culture to play to your strengths. Each individual is different, and you should communicate with coworkers and patients in a way that is sensitive to everyone's needs. Look at cultural diversity as an asset, and make the most of the differences among people in emergency medical service, thus improving our ability to provide optimum patient care. As the public safety workplace becomes more culturally diverse, changes may occur that could be considered disruptive. Alternatively, failure to diversify the workforce in the face of a culturally diverse patient population can lead to cultural incompetence. Diversity is an effective way to strengthen a public safety workforce. It is important to strive for cultural competency with coworkers as well as patients. Your ultimate goal should be cultural humility. This requires that you remain curious about others, and continuously reflect on your viewpoints with an open mind. This process will allow you to constantly monitor your attitudes toward others, remain aware of your biases, and adapt your viewpoints if needed. It is sometimes difficult to be open and accepting of others who are different from yourself. To achieve cultural humility, you must first recognize the differences between yourself and those of other cultures, accept the differences, and in some cases adapt your behaviors based on them. This process is difficult for some, requiring much self-awareness and self-reflection, but it can yield rich rewards. Your effectiveness as an emergency medical technician. To be an effective emergency medical technician, you need to discover the diverse cultural needs of your coworkers, as well as your patients and their families. Although it is unrealistic to expect you to become a cross-cultural expert with knowledge about all ethnicities, you should learn how to relate effectively. Teamwork is essential in public safety and emergency medical service. To work effectively as a team, you need to communicate to resolve cultural diversity issues. When you are working with patients or calling the hospital on the radio, other emergency medical technicians may be sensitive to how you treat patients from their cultural group. Therefore, when referring to patients, you should use the appropriate language. Do not use terms such as cripple, deformed, drunk, crazy, and retard to describe patients. The word handicapped even has a negative connotation. Instead, use the term disabled, and describe the specific disability. You might want to consider taking multilingual training classes. This will not only be useful in communicating with your coworkers, it will also help improve communication with your patients, and sensitize you to the cultural richness of the people who are using the language. Even the perception of discrimination can weaken morale and motivation and negatively affect the goal of emergency medical service. Therefore, to achieve the benefits of cultural diversity in the emergency medical service workplace, you must understand how to communicate effectively with coworkers from various backgrounds. Sexual harassment. The number of reports of sexual harassment has increased in recent years because of increased scrutiny, along with guilty verdicts that have encouraged others to bring lawsuits concerning conduct that previously would have gone unchallenged. Sexual harassment is any unwelcome sexual advance, request for sexual favors, or other verbal or physical conduct of a sexual nature when submitting is a condition of employment, submitting or rejecting is a basis for an employment decision, or such conduct substantially interferes with performance and/or creates a hostile or offensive work environment. Remember, even an overheard conversation can be construed as sexual harassment. There are two types of sexual harassment: quid pro quo. The harasser requests sexual favors in exchange for something else, such as a promotion, and hostile work environment, jokes, touching, leering, requests for a date, talking about body parts. Sexual harassment incidents include complaints of a hostile work environment. Remember, the intent of the harasser does not matter. What matters is the perception of the act, and the effect the behavior has on someone else. For many years, it was not uncommon to walk into a fire station and see sexually suggestive posters, calendars, or cartoons and to hear sexual jokes or comments. This situation has changed because it is not acceptable professional practice. Because emergency medical technicians and other public safety professionals depend on each other for their safety, it is especially important for you to develop non-adversarial relationships with coworkers. If you are concerned about a particular behavior, it may be helpful to ask yourself these questions: would I do or say this in front of my spouse, significant other, or parents? Would I want my family members to be exposed to this behavior? Would I want my behavior videotaped and shown on the evening news? If you have been harassed, you should report it according to local policy and procedure and keep notes of what happened and what was said. Substance abuse. Drug and alcohol use in the workplace causes an increase in accidents and tension among workers, but most important, it can lead to poor treatment decisions. Emergency medical service personnel who use or abuse substances such as alcohol or marijuana are more likely to have problems with their work habits, and their driver's licenses may be revoked as a result. They may be absent from work more often than other workers. If the use of drugs or alcohol has occurred within hours before the start of their shift, the ability of emergency medical service personnel to render emergency medical care may be diminished because of mental or physical impairment. Because of the seriousness of substance abuse or misuse, many emergency medical service systems now require personnel to undergo periodic random tests for illegal drug use, and have for-cause testing when it is believed that individuals are under the influence of alcohol or drugs. If you observe a coworker who appears impaired, it is your responsibility to immediately report to a supervisor. Covering for this type of behavior is not appropriate and has the potential to cause irreversible harm. As a member of the emergency medical service team, you are responsible for responding to the community's emergency medical needs. Hazards in the emergency medical service workplace are many. If you or one of the members of your team has an alcohol or other drug problem, these risks are increased. Furthermore, drug use that occurs off the job does not necessarily decrease the risk if a team member is showing up at work still under the influence of a substance. Although it varies from state to state, a drug-related or alcohol-related arrest can result in the revocation of some or all driving privileges, and even loss of emergency medical technician licensure. Employee assistance programs are often available for emergency medical service personnel. These agencies are contracted with the Emergency Medical Service Department to provide a wide array of mental health, substance abuse, crisis management, and counseling services. Talk with your supervisor about resources that are available at your Emergency Medical Service Department. Early intervention is the best bet to ensure a safe, alcohol and drug-free workplace. Injury and illness prevention. According to the Bureau of Labor Statistics, approximately 4.1 million serious injuries and 4,500 deaths occur in United States workplaces, with a direct cost of more than $1 billion each year. Emergency medical service providers visit emergency departments for work-related injuries and exposures over 20,000 times each year. As an emergency medical technician, you are most at risk for sprains and strains, exposures to blood and body fluids, and falls. Simple measures such as practicing safe lifting, using appropriate personal protective equipment, and wearing slip-resistant footwear can reduce the incidence of these visits. Many companies, as well as emergency medical service departments, have established injury and illness prevention programs to determine workplace hazards and implement a plan to mitigate those hazards. Each injury and illness prevention program should involve management and workers and include hazard identification, prevention and control, education and training, and program evaluation. Data show that injury and illness prevention programs pay dividends for the companies that implement them. Find out if your company has an injury and illness prevention program and learn how you can participate.